Welcome back. Here's another lecture from Matthew McKenzie, care activist. And this time I'm going to be talking about a topic that's really not pleasant, but it does happen. And I don't think many carers are told this. Anyway, let's jump straight into it. I present on unpaid carers in a sense on how they can carry out their caring role and also engage with services. But most of the time, I tend to focus on those who are caring for someone unpaid, obviously in a family or close friend, and that person is living with mental ill health. So basically, even though I'm talking from this from like let's say a mental health care perspective, this can be applied to all unpaid carers situation. As you can tell by the title, it steps to escalations when it comes to complaints by unpaid carers. So it doesn't always have to be mental health carers. But let's jump straight into it. What will I be talking about with this lecture? But basically, what is a complaint and why you should escalate it if you're caring for someone who is using the services, who's using hospital or health or mental health services, or even GP services like your doctor. Something unfortunate's happened and you think, well, that's it, I'm going to complain. But then there's situations where you're going to escalate because you're not happy with the outcome. So we'll be going for a bit of that. We'll start at what we'd call a basic level of complaint and looking at the most basic sort of resolution you can reach and hopefully not go beyond that. If that doesn't work, though, you might be looking at a written complaint to the service provider, that being the health provider, like hospital, mental health service, that type of thing. And this time it would be an intermediate level. So basically, you're escalating that complaint. So we'll be looking at, why you would do that, and what's involved, and who you would be contacting. If the following two don't work, sorry, the previous two don't work, then it's another escalation to the patient advice liaison service. Now, when talking about PALS, that's more like, again, hospital-based services. It's not always, when you contact them, it's not always about complaints, but on this lecture, it is. So we'll be looking into how that would be done through PALS. Then we'll escalate again, formal complaints to regulatory bodies, and this is at an advanced level. One thing to note at this type of level, complaints take longer to resolve, but they can be more serious complaints that can have damaging consequences to the organizations that you're complaining about. Remember, this is complaints about health services that your loved one, or even social care, actually, health and social care services that your loved one is using, though that being that person's suffering long-term illness, or the health professionals haven't been engaging with yourself and you might have complained about them. So it might not always be about the patient using the services. This is more severe. This is obviously when something serious has happened and the previous complaints weren't resolved. But most of the time it's something really serious has happened and you're now looking at legal action. So we'll be looking at that and what's involved and why you would do this, when to go about legal action. Then we'll sum up this lecture really. So let's start. So what is a complaint and why should you escalate it? Well, as a carer, if you need to raise concerns about the care being provided to your loved one, that being a service user, or your experience of the mental health system, there are different levels of complaint you can pursue from an informal concerns, and hopefully it won't go any further, hence formal complaints. But then there's times when, unfortunately, you have to escalate. So what would it involve regarding, let's say, the basic level of an informal complaint, or if that looks to a resolution, which is the outcome? Well, you might actually be speaking to the health professional that you're concerned about. It could be a social worker, it could be a care coordinator. And before you go any further, you can just start by raising your concern directly with the person involved that in regards to your loved one's care, such as the care coordinator or another key member of the community mental health team. You could just speak to them, just say, what you're upset about, what you're concerned about. You don't might not go any further. So is a good example. If you notice delays in communication or feel that the service user care plan isn't really being followed, and when it comes to care plan, this is really how you hold one of the tools, how you hold, those services to account in regards to that care plan. So what it would be really is, and I've complained before, but usually it would be down to like a face-to-face meeting and nothing more than that. You request a meeting with the relevant mental health professional, such as the team leader or person who's in charge of the social worker or the care coordinator to discuss your concerns in person. And it's not just you go there and meet them, and you would need to prepare in order to get a bit of a resolution. You don't just turn up without any preparation. So if it does come to things like that, you would need dates of or when things are not being followed through. You actually need a care plan with you as well, to be honest. So this is usually the quickest way to resolve misunderstandings or small issues before they escalate. But remember, this doesn't always happen, and we'll see why in a bit. So when to use it? Minor issues, communication problems, or delays, and when you believe a direct conversation could resolve the problem. To be honest, most carers tend to be a bit scared when having to complain, but I always say, if you're not getting the best service you can get, it's in your carer's rights to complain. Um, quite a lot of mental health organizations have leaflets around like PALS, and I'll mention or they should mention the complaints process, and there should be a policy on the complaints process as well. So let's say things didn't work out. So you now decide to start writing. You actually can even write in the previous complaint. You don't have to leave it to this level, but this is getting more serious in an intermediate level. So if your informal attempts to resolve the issue fail, or the problem is more complex, you might need to submit a written complaint. But again, this is something you must prepare for. You can't just write things out. You need to look for evidence. The more evidence you have, the more the outcome will be in your favor. So, okay, you submit a formal complaint. Most mental health service providers, including NHS Trust in the UK, have a complaints process. I did mention this earlier. Complaints process in a leaflet or complaints policy. This usually involves submitting a written complaint detailing your concerns. So you would state that if you're going to go down this route, it's going to be fairly similar. It's going to go to to the trust's complaints team or the service manager or the trust complaints department. That's not too similar, actually. These are complaints departments. That's different from PALS, actually. What includes are basically details of your concern, records of prior communication attempts. Hence, you did try to resolve it in a basic manner, but it still didn't work. No one got back to you. No one's responded, and the issue hasn't been resolved. You'll definitely need dates of when things are not got back to you, or dates of incidents. You definitely need the names of the person involved, and what you would want as a desired outcome. So an example would be that you want to be heard on your concern and you want a resolution regarding your concern. So usually the time frame, it varies though, but after filing a written complaint, the service provider will typically acknowledge a complaint to say that they've received it, and they should provide at least some idea of a timeline for investigation, usually 20 to 40 working days, depending on the complexity of that event or the complaint. So when would you use it? Well, again, if you've attempted to resolve the issue informally, but still nothing has improved, and I would say that the example would be like the social worker or care coordinator was maybe rude and didn't respond to your requests. For moderate concerns, when you want to go down this route, would be about the quality of care, such as frequent delays in care, lack of follow-up, or inadequate treatment planning. So let's go into an escalation to PALS. I mentioned PALS a few times before, or advocacy service. In fact, you can watch a whole video that I've done. It might be the previous video actually to this one regarding advocacy services. And this is now at intermediate level. And when it gets higher levels, it gets a bit more tricky because you have to provide more information. And it also can be an emotional roller coaster for the carer complaining. So again, the reason why we've got to this intermediate level is if the complaint really, the written complaint doesn't bring any resolution, or there's no response, or if you need help navigating the complaints process, and PALS, and I mentioned in the UK, which is the Patient Advice Liaison Service, can help, and also Advocacy Service can even assist in drafting up a complaint and where it would go to. So the steps in regards to this would be obviously to contact PALS. PALS offer confidential advice and can act as a mediator. They're not the only ones that can act as a mediator, but they can also act as a mediator between you and the mental health team. They can even escalate your complaint within the mental health service provider. Advocacy services, they can also represent you and help you communicate effectively with the community mental health team or the care provider. Remember, watch the video that I've done previously to this one. So when would you use it? Again, if your written complaint has not been adequately resolved, or you need help understanding the complaints process so you don't waste your time submitting the complaint. For carers who feel overwhelmed or a lack of confidence in navigating the system, again, this is pointing to advocates and PALS. So you just need more help basically in pushing that complaint, escalating it. So this is getting really serious this time. The regulatory body will more likely be your CQC. The other bodies as well I'm going to mention here, but if you're dissatisfied with your response to your formal complaint from the service provider, you can escalate it again. And the concern would go to an external regulatory body. And you've got to be, one thing I need to know about these bodies is that the complaints process will take a long time. I don't think a fair number of them will be resolved in a speedy time. But here's one of the bodies, the Health Service Ombudsman. Now, in the UK, the Parliamentary and Health Service Ombudsman can investigate if your complaint has not been satisfactorily resolved through the service provider's formal complaints process. But don't expect this to be a speedy affair. You certainly need to show that you've, in fact, and they would tell you, have you, talking about the ombudsman, they'll always recommend that you talk to the provider, follow the complaints process before you reach this stage. You at least need to show and prove that you've attempted to resolve the complaint with the service provider. And if the ombudsman sees that you have, tried your best to resolve, then that's when they sort of get involved. The ombudsman will assess the case, may investigate further, ensuring that the complaint is handled fairly. And as mentioned, the CQC, basically Care Quality Commission, which provides, they're the regulatory body for not just NHS trusts, but GP services, social care, that type of thing. So while the CQC doesn't really handle individual complaints, you can report concerns about the quality of care, staffing issues, or unsafe practices, and they can trigger an inspection if they identify significant failings in service provision. So it's always, and even if you don't have a complaint, it's always recommended that you feed back, how services have been handling your loved one's care, even if it's not a complaint. It's always good to feedback to the CQC if you've got the time, obviously. And when would you use this advanced level? Basically, if your written complaint was ignored, there's no response, there's no read receipt. If you emailed them, you've been ringing them and no one's answering the phone, and this is, been going on over a period of time, and the person you're caring for, their health is suffering, or it could be not adequately addressed. You get like a paragraph answer and nothing else, and it's not really been resolved in a reasonable time frame. Again, serious concerns like poor quality care, negligence, unsafe practices. I think a good one is restraint, to be honest. The use of restraint on your loved one. And if it was unnecessary, they weren't causing any, your loved one or the service user in an inpatient ward wasn't causing any problems, but restraint was used. So now we're going to a severe level. Not This is not the last escalation. I might mention a few other things that was not mentioned here. But in cases where the service user or carer has experienced significant harm, neglect, malpractice, you may need to seek legal advice and consider pursuing legal action. Obviously, there's a cost to this thing. To contact a solicitor, obviously, and this might end up being a mental health solicitor. You've got different types of solicitors out there. It depends what the issue is. But yeah, you consult a solicitor who specializes in healthcare and mental health law. They can advise you on whether the situation warrants legal action. And going back to the solicitor, it's always good to just shop around. You don't just go to the first one that you found off the internet. And even on mental health wards, they should have a list of solicitors you can contact, where solicitors tend to work close to mental health trusts in representing patients and families. So going back to this potential legal action, usually negligence, breach of duty of care, infringement of service user rights, as I mentioned, example is restraint, compensation claim if there's evidence of harm or injury. So yeah, you're going to sue. So due to negligence, you may pursue a compensation claim. When would you use this? So if the service user has suffered harm due to severe neglect, malpractice, or a serious breach of duty, and you might come, actually could also, what should have added is his serious incidents where the service user has died, or been killed, and you want to take this to, obviously they investigated before you get this far, but you would be seeking legal action. For instances involving physical harm, inappropriate treatment, severe rights violations. So this is now the severe level. And I think if it's not mentioned here, I can't fully remember. I will mention a few other things that are going even more severe. And this is where you will bring attention to the malpractice, to the complaints. You've tried every level you can. You've submitted a complaint to the CQC. You've tried PALS. You've tried all that you can to get this issue resolved. So this is basically the last resort. It does take a bit of research, but if all internal and informal routes have failed, and the issue involves systematic failing, so it's not just happening to you, it's happening to other carers whose loved ones using the health service, and they start talking to each other, and they start talking to other carers, and the group says like, enough is enough, we need to bring attention to this issue. So the issue involves systematic failings, widespread injustices. Carers may consider taking their concerns to media or public campaign. So you contact the press or even social media. And the idea if a service user experience of severe mistreatment, some carers might even turn to journalists just to raise the issue, mental health advocates or social media to highlight that issue. It might even involve mental health charities who will advocate and also will bring attention to the media in a big way. So organizations like Mind or Rethink Mental Illness, or even Carers UK, Carers Trust. can amplify your voice and draw attention to systematic failures. When would you use it? This is basically I don't think it is the last resort. It's one of the last resorts if the issue affects multiple service users, as I mentioned, or multiple carers, or represents a systematic failure that hasn't been resolved through formal channels. And also for severe ongoing issues that require public attention, remember you're raising awareness to the media, which will probably force a policy change if the trust is found to be at fault. So there are others. I mean, I'll mention one, which is probably linked in with the severe complaints, and one of them is to see your MP. So they can sometimes raise concerns back to the NHS Trust, and they can do a whole range of other things. It's not to say that they're going to use them, but they're very influential. And when they raise things, most people definitely know about the situation. They can actually do a campaign in regards to complaints that I mentioned at the hospital. So going back again to summarize things up, informal resolution would lead to, like say, a direct conversation with the care coordinator, just a simple word in the air. And you might hand a letter to them for record keeping, or mental health worker for minor concerns. But unfortunately, this might not always be resolved. So you could look at written complaints, formal complaint to the service provider. Again, the reason to write down is that it's kept on record. And it's mainly used for moderate issues that haven't really been resolved informally. Then you've got PALS, which is the Patient Advice Liaison Service. This can look at mediation and assistance with formal complaints. Regulatory bodies, Ombudsman, CQC, and actually Health Watch is a good one. They don't have much powers, but Health Watch can actually go on boards, can raise awareness in reports. They write a report up, and you can usually go on their site. So do take notes. You can check out Health Watch as well. They work closely with the providers also. Escalate this sort of step would be escalation for unresolved or serious complaints. Then legal actions in case, for cases of negligence or absolute serious harm. Then you got the last resort, if for systematic or unresolved issues of significant concern. Now, by following this structured approach, carers can actually raise concerns at an appropriate level, but it does depend on the severity of the issue. And the idea is really to ensure that your voice is heard. So if you like this presentation, give me a like. The more the merrier, really. Do hope that you can also subscribe to my channel. And as I said, raise awareness of unpaid carers. You might come across a poem or two off my YouTube channel. And I'd like to say thanks for watching, and I'll see you again soon.